And there is fresh data tonight showing a sizable increase in Alzheimer's patients in Missouri and Illinois. That is concerning, but just as troubling, the help to treat this and other memory disorders is not there, nor is it in view. Here's News 4's Jenna Ray.
It started a few years ago. I noticed a change in her behavior, and the doctor dismissed every single issue.
St. Louis native Amy Cottrell's story is similar to many across Missouri.
She was sleeping a lot. She was in bed a lot. She missed family functions.
This past December, Cottrell's mother was diagnosed with a disease more than 6 million Americans deal with daily.
The doctor said she has dementia, and she presented us with 2 pages of action that needed to be taken.
According to the Alzheimer's Association, nearly 200,000 Missourians are caring for family members with memory care diseases. That far outweighs the professional workforce of about 75,000. And the association says that number needs to drastically change.
We are going to need double-digit increases in the number of people who are providing that direct care to adequately support those living with dementia.
Sarah Lovegreen with the Alzheimer's Association Greater Missouri chapter says they're in desperate need of geriatricians and health home and personal care aides like nurses and nursing assistants. A lack of caretakers isn't the only issue.
My biggest concern is the long-term outlook, right? So my parents are leading edge baby boomers, and I know there's a lot of folks coming behind them. With age being the largest risk factor for the disease, we're just going to have a very high burden.
In 2020, more than 120,000 Missourians were diagnosed with Alzheimer's. That number expected to surpass more than 130,000 in just 3 years. In Illinois, there are more than 230,000 living with Alzheimer's, and by 2025, it could be more than 260,000. It's clear more attention, awareness, and resources are greatly needed.
How can we help raise awareness with our constituents so they can have the appropriate conversations with their family members and providers, and then being sure we're equipping providers with the tools to help address those concerns.
Cottrell says she wants to see lawmakers step in and help.
There needs to be the proper funding given to this problem. I think they really need to look at that and make a push for getting people to join that workforce, create an incentive.
Amy Cottrell, who you just heard from, says taking those initial steps to actually see a doctor for proper memory care diagnosis was challenging for her family. The Alzheimer's Association is working to change that. The association says dealing with memory disorders should involve normal, regular conversations. And you guys, we have several resources on our KMOV News app now from the Alzheimer's Association to help those of you at home who may be dealing with this.
Such a tremendous need out there. You hope that folks do step up to the plate in the future and that there are some incentives for people to get into that workforce.
Yeah, and it should be an easy conversation to be
and
had.
something we've covered extensively, and a lot of people younger and younger are being diagnosed with